Hi friends, welcome to Daily Eye Care with Dr. Oge. Okay, today I want to talk about conjunctivitis, or rather, let me use the popular word we know, Apollo. Okay, yes, we all call it Apollo, but the medical term is called conjunctivitis. Now, conjunctivitis is actually an inflammatory condition of the conjunctiva. Yes, you can see my eyes. Now, look at this. Once I open this, you can see the black part of the eye, which is called the cornea. Then you see the white part around the black part. That's the conjunctiva. Yes, conjunctiva. Now, when there is an inflammation of this white part of the eye, it's called conjunctivitis. Actually, it presents most times with a lot of redness. When the redness covers this white part of the eye, then you'll be like, my eyes are red, my eyes are red, I need this, I need that, and all that. So that is called conjunctivitis, inflammation of this white part of the eye called the conjunctiva, which is now called conjunctivitis. Now, um, there are tiny blood vessels in this white part of the eye. Yes, look at this white part of the eye. There are tiny blood vessels inside, which are not usually seen. We don't usually see them, but there are tiny blood vessels there. So conjunctivitis now has to do with when there is an inflammation, or when germs, dirt, dust enters the eye and enters those blood vessels. It makes those tiny blood vessels to enlarge. They get enlarged, and when they now get enlarged, you see the eyes turn red. So that's when you actually notice that, my eyes are red, my eyes are red. So that is the inflammation of the conjunctiva, which now results to what we call conjunctivitis. Now, conjunctivitis can present in different ways. One, first of all, it usually comes with redness of the eyes. The eyes will turn red. Then it comes with itching. You see yourself itching, and rubbing the eye. For people, so many people, tears will just be flowing down their cheeks from their eyes. Then some people wake up in the morning, they wake up with discharges. The eyes will gum together. Then when the discharges get dry, you see them peeling it off from the eyes. Now, also some people, conjunctivitis can also come with sensitivity to light. I don't want to, that light is too bright, please put it off, it's too bright. That's photophobia. It can come with conjunctivitis can come with that. Then there are times when some people feel like there's sand in their eyes, but there is no sand. That is foreign body sensation, like there is sand inside the eye. Most times is a symptom of a conjunctivitis. Conjunctivitis has medications. There are medications you can use to treat them. A patient told me the other day that he woke up and noticed his eyes are turned red and the eyes were gumming together. So he just went and took a scent leaf, squeezed it, and put the drops of water in the eye. Please, no need to use herbal, unformulated, traditional medications on your eyes. This is an organic, the eye, it is alive. So there are medications for every problem in the eyes. There are medications for everything that has to do with the eyes. If it is Apollo, as we all know it to be, which we call conjunctivitis, there are medications for that. Whatever condition that takes place in the eye has medication or surgical treatment. So for conjunctivitis, there are medications which are sold even in the pharmacies that you can get to treat conjunctivitis. Yes, it's true. Most people, when someone has Apollo, it's as if they want to separate the person from the rest of every other body, so every other person, so that it won't be, and other people will not contact it. Now, I want to tell us that conjunctivitis doesn't just pass from one person to another. There must be a means of transfer. If I have conjunctivitis now and I have a handkerchief which I use, and I use the handkerchief to clean the tears or the gummy things that are coming out from my eyes, and someone else uses that handkerchief, why won't that person get it? Definitely the person will get the conjunctivitis. And if a situation, in a situation where I use my fingers and rub my eyes, clean my eye, and then I still use those fingers to touch somebody else, of course the person will get conjunctivitis. So there's always a route or a means of transfer before somebody can get it. Now I will advise you, if you have any of these symptoms, redness, itching, tearing, light sensitivity, or even swelling, the eyelids will puff up, like will swell, please see your eye doctor for proper examination and treatment. Thank you.